Age seems to have an effect on a person's response to illness. The younger a person is at onset, the poorer the outcomes tend to be. These people are less likely to have effective coping skills due to their lack of independent living, the chance to work and be self-sufficient, and to have a well-developed sense of themselves. At a younger age, they may also express their illness differently. A young child doesn't understand their feelings or know how to express them. Erickson's Stages of Psychosocial Development on page 121 states that moving to a higher stage in development is dependent on completing the previous stage. So people can get stuck on a stage and be unable to progress. If someone didn't complete the stage of autonomy, they may be overly dependent on others. Failure to develop identity can cause role confusion and a lack of understanding on who they are. Failure to develop trust as an infant may lead that person to not being able to trust and love others later in life. Adults also have developmental tasks. For example, a young adult between the ages of about 25 to 45 is supposed to be able to stabilize their self-image and establish a career. But what if that person's schizophrenic? How well are they going to be able to achieve these developmental tasks? Genetics and biologic factors are not under voluntary control. We can't change these things. Several mental disorders have genetic links, like Alzheimer's. Even disorders without genetic links, they still tend to appear more frequently in families, things like bipolar and depression. Genetic makeup influences a person's response to illness, so family history and background are important elements to a nursing assessment. The healthier a person is, the better they'll respond to an illness or stress. Some factors in physical health include sleep, nutrition status, chronic illness. If a person is in a manic phase of bipolar and isn't really sleeping or eating, how well is that person going to handle another stressor in their life? How a person lives is under their control, and it can also influence their overall health. Some personal health practices include exercise, which can help to diminish depression and anxiety. If the person participates in group exercise, then they also add the social support to that improved well-being. Biology can also affect a person's response to drugs. Some ethnic groups metabolize drugs slower than others, which will raise the serum level of the drug and make their side effects more severe. These people will need a lower dose of the medication than others do to get the same effect. Self-efficacy is the belief that personal abilities and efforts affect the events in our lives. If you believe that you're going to make a difference, you're more likely to act. Those who have a high self-efficacy set goals, are self-motivated, cope better with stress, and are more likely to ask for help when they need it. Those with a low self-efficacy are the opposite. They have low aspirations, a lot of self-doubt, and they may be anxious and depressed. Those who are returning to the community with a higher self-efficacy are more likely to do better. These people are more confident, and they have positive expectations. Hardiness is the ability to resist illness when under stress. There are 3 components to hardiness. Commitment is an active involvement in life's activities. Control is the ability to make appropriate decisions in life's activities. And challenge is the ability to perceive change as beneficial rather than simply as stressful. Personal hardiness is a pattern of attitudes and actions that helps the person turn stressful circumstances into opportunities for growth. Some with high hardiness will see stressors more accurately and be able to solve the problem more effectively. It's an important resilience factor. Resilience is to have healthy responses to stressful circumstances or risky situations. High resilience is associated with promoting and protecting your mental health and coping successfully. Resourcefulness involves using problem-solving skills and believing that you can cope with novel or adverse situations. Resourcefulness is developed through successfully coping with life situations. Spirituality involves the essence of a person's being and their beliefs about the meaning of life and the purpose for living. It may include a belief in God or a higher power, religion, cultural beliefs, and a relationship with the environment. Spirituality can be a source of comfort when stressed or when someone's experiencing a trauma. It can be a coping device and provide a social support network. Religion and spirituality provide support both to the individual and the family. A sense of belonging is the feeling of connectedness with or the involvement in a social system or environment of which a person feels an integral part. Maslow has a sense of belonging as a basic psychosocial need that involves both value and fit. Value refers to feeling needed and accepted. Fit refers to feeling that one meshes with the system or the environment. This means that when someone belongs to a group, they feel worthwhile within that group. A feeling of belonging promotes health and decreases anxiety. Social networks are groups of people a person knows and feels connected to. Having a social network can help reduce stress, diminish illness, and help cope. Those who have this emotional support are healthier than those who don't have it. There are two components for a support system to be effective: the person's perception of the support system and the responsiveness of the support system. The person has to believe that their friends and family will respond when they have a need, like helping them solve a problem. But it has to be in the way the person wants, rather than what the friend or family member thinks is best for them. Family support can be a key factor in recovery, particularly for those with a mental illness. Family members may not always be a positive resource, but they are usually an important part of a person's recovery. Culturally competent nursing care means being sensitive to issues related to culture, race, gender, sexual orientation, social class, economic situation, and so forth. Learning about cultural beliefs and practices is a part of providing holistic care to the patient. Culture has a big influence on a person's health beliefs and practices. In non-Western cultures, there are two prevalent beliefs about the cause of illness. The natural belief says that illness comes from natural causes, things like cold, heat, wind, or dampness. The unnatural belief says that illness is caused by an outside agent, spirit, or supernatural force, or what we call a deity. Those who have these beliefs may not make a connection between their actions and the illness, so they may not be willing to take medication or to change their health practices. There are 6 factors in performing a cultural assessment. Communication. It can be difficult if you don't speak the same language. And be aware of how nonverbal communication is perceived by that culture. Some will welcome touch, while others find it offensive. Western cultures see eye contact as positive, but other cultures see it as rude. Physical distance, usually 2 to 3 feet, is comfortable in Western cultures, but Latin America and those from the Middle East tend to stand closer, and Asians and Native Americans may prefer to be further away. Social organization. This includes family structure, religious values and beliefs, ethnicity. These will all affect the person's role in their culture and their behavior when they're sick or healthy. In Western cultures, you may ask a friend or a family member for advice, call your mom, but most people are going to make their own decisions. However, in Mexican, Vietnamese, and Puerto Rican cultures, the family is usually involved in healthcare decisions, so a patient from one of these cultures may want to wait to make a decision until they can talk to the appropriate family members. Time orientation. Do you see it as precise or approximate? Western cultures tend to value punctuality and precise schedules. How many of you want to see your nursing schedule as soon as you can get it? Other cultures don't place such importance on adhering to such a rigid schedule. These patients may be late for appointments, or they may miss them completely. They may not follow their medication schedule as precisely as we would like them to. So these patients may need to have the importance of this schedule explained to them very carefully. Environmental control. This is the person's ability to control their surroundings or to direct factors in the environment. If someone believes that they have control over their care, they're more likely to seek care, change their behavior, and follow the treatment recommendations. Biologic variations. These exist between people of various cultural backgrounds, and we're only starting to understand why. Socioeconomic status refers to your income, education, and occupation. It has a big influence on health, like whether or not you have insurance, access to care, and if you can afford the treatment and medication. Those who live in poverty frequently face hazards like inadequate housing, lead paint, gang violence, drugs, and substandard schools. In some countries, social class has a big impact on relationships and how people relate to each other, like the caste system in India. The nurse has to determine whether or not social class is a factor in how the patient relates to the healthcare providers and the system. A knowledge of expected cultural patterns can be a starting point for a nurse to relate to patients from a different cultural background. Being aware of the usual differences can help us know what to ask and how to assess the patient. However, there are variations among people in the same cultural group, and not everyone will fit into the expected mode. African Americans will most likely want to maintain their own independence and make their own healthcare decisions, but family is a big support for this cultural group. The families frequently will feel very comfortable with public affection like hugging or touching each other, and conversation can be very loud and animated. When they're greeting somebody they don't know, it will usually be with a handshake and direct eye contact. Um, Silence might indicate a lack of trust for the caregiver or the situation. Church is a big support for this cultural group. They may have a lot of visitors from church and from their pastor. Um, Prayer is an important part of healing for them. Some of the people in this community do feel that illness is caused from sin or from a spiritual imbalance. Sometimes they will use folk remedies along with Western medicine. For American Indians or Native Americans, communication is probably going to be slow. There will probably be long pauses. Don't try and rush them or interrupt them with questions. That's viewed very negatively. Family members are usually reluctant to provide a lot of information about the patient if the patient is able to do so themselves. They believe that it violates the person's privacy to talk about them. Greeting is probably going to be a light touch handshake. They don't make a lot of direct eye contact. Time orientation is flexible. This group may have a lot of trouble with scheduled appointments, medication. They do believe that mental illness is caused by things like ghosts or breaking taboo, or they're not in harmony with the environment. They may have a medicine bag with them with healing objects. This is something that we need to not touch as healthcare providers and just leave it alone. Arab Americans will probably greet you with a smile, some direct eye contact, some sort of social comment about their family or about the patient. Family will be a part of the decision-making process. Most likely there's going to be a family spokesperson, the eldest male frequently. Most appointments are viewed as official and are going to be kept, but human problems are seen as more valued, so they may not make it. Mental illness for Arab Americans is frequently seen as the wrath of God or God's will. It can also be seen as a sudden fear or an attempt to manipulate them. There is a stigma with mental health in this culture, so they're probably going to try other things first and will seek treatment only if everything else they've tried has failed. Those from Cambodia are likely to greet you with a bow. They will probably bring the palms together with the fingers pointing up and not make contact with you when they're greeting you. If the person is assimilated more into the Western culture, you may get a handshake on greeting them. They do tend to speak softly, so you need to listen really carefully rather than asking them to talk louder. Silence is common and appropriate, so don't just sit there and chatter on with them. Women may lower their eyes to be polite, so eye contact may happen or it may not. Cambodians consider it impolite to disagree with you, so they might say yes when they really don't intend to do what you've asked them to do. So you do need to follow up on that. It is inappropriate with this cultural group to touch their head without permission because they believe that the soul is found in the head. They do have family members that help to make decisions. Their time orientation is probably flexible, so you will need to talk to them about medication schedules and keeping appointments. When they are sick, they tend to assume a passive role and expect other people to take care of them. Um, Sometimes they'll use Western medicine and traditional healing practices simultaneously. The Chinese are often shy when they're in an unfamiliar environment, so you may need to offer them a friendly greeting to be helpful. They usually will also avoid direct eye contact with those they see in authority, which does include healthcare providers. So they may not make a lot of eye contact with you. Just keep a respectful distance and be respectful of their culture. Asking them a lot of questions can be a sign of disrespect, and silence is a sign of respect. Chinese don't value time urgency the same way that Western cultures do, so you may need to explain schedules to them as well. In this culture, too, the eldest male is the one who's going to be making decisions and will be the spokesperson for the family. Mental illness in this culture is thought to be a lack of harmony of emotions, or it comes from evil spirits. Their health practices are going to vary depending on how long they have lived in the United States. Cubans are typically pretty loud and pretty outgoing. Um, they will probably expect direct eye contact during a conversation and may see you looking away as you don't respect them or you're being dishonest. Extended family is important in this culture, and there's usually more than one generation that lives in the same household. Silence will probably indicate awkwardness or that you're uncertain. Their orientation to social time may vary greatly, so some will see appointments and as important and be punctual, and others may not. Mental illness is a stigma, so they may hide or not publicly acknowledge these problems. The ill person tends to take on a submissive role and expect others to take care of them. These patients may also use herbal medicine, so you need to ask about that with this culture. When you are greeting a Filipino, they are more likely to want to smile rather than shake your hand. Their facial expressions are very animated, and they may use these facial expressions rather than words to try and convey how they're feeling. Filipinos do consider direct eye contact to be impolite, so they may not make very much eye contact with you. Nurses and physicians, of course, are seen as authority figures, and they may be very reluctant to make direct eye contact. They are typically soft-spoken and avoid expressing disagreement. They may get louder to emphasize what they're saying or to show anxiety or fear. They think that the cause of mental illness is both religious and mystical. They are likely to see mental illness as a result of a disruption in the harmonious function of the person and the spiritual world. Prayer is important to Filipinos, and they do tend to be very religious. Most of them are Catholic. So if they are sick and in the hospital, they might want to have both a priest and a doctor. They will frequently seek both Western medical treatment and the help of their traditional healers to remove evil spirits. When one of them is sick, they usually will assume a passive role, and the oldest male is going to be the decision maker after talking things over with the family. Haitians will probably greet you with a handshake, but they are very shy, but polite, especially with people they see in authority. Another cultural group that might avoid direct eye contact with you. They will probably smile and nod to show respect, even if they don't understand what you're saying. So if you're trying to give them some education, make sure that they are able to teach back. Mental illness is not really accepted in the Haitian culture. They usually believe that mental illness comes from supernatural causes and will probably try folk remedies first before they go in for treatment. For the Japanese, their greetings tend to be very formal. They will smile or give a small bow if they are one of the older generations, or the younger generation will probably greet you with a handshake. They don't touch a lot and will probably not make a lot of eye contact with you. They do control their facial expressions and avoid disagreement. They might nod frequently, but that doesn't necessarily mean that they understand you. They're not likely to talk a lot about themselves unless they trust you, and then only if the information is asked for. As the nurse, you do need to make sure that you're phrasing questions to get more than just a yes or no answer, so you need to be using your open-ended questions. The Japanese do value promptness. These patients are not likely going to miss their appointments. They may be early. The Japanese view mental illness as shameful, and there's a big social stigma to the family, so the Japanese are usually very reluctant to get help. It's thought to be caused by evil spirits, or as some sort of punishment for bad behavior or failure to live a good life. With Mexicans, they will probably greet you with a handshake, but other than that, they don't like to be touched a lot, except with family and friends. They will probably avoid a lot of direct eye contact with you as an authority figure. They usually prefer social interaction to establish a rapport before they start answering a lot of questions. Silence with this cultural group is often a sign of disagreement. So they may not verbally disagree, they may just be silent. They do have a flexible time orientation. They may show up 15 minutes or so late for an appointment, but not really consider themselves late. They don't really separate mental and physical illness. They do believe that disease is based on the imbalance of the person or the environment, and that includes all illness. They will seek care if they're experiencing severe symptoms, but they'll probably also use some folk medicine to deal with their illness as well. Personal space varies a lot among the Puerto Ricans, so you need to look at the individual. Usually the older generation is more likely to prefer distance and not making a lot of eye contact, where the younger generation will probably make a lot more eye contact and get closer. Puerto Ricans also don't have a rigid time schedule, so they may be late for appointments, or they may extend out their appointments and stay longer than you expect them to. They like to show gratitude through cooking, so they might offer you a meal or some sort of treat, and refusing that is seen as being insulting. Physical illness is seen as hereditary or a punishment for sin or a lack of attention to your personal health, while mental illness is seen to be hereditary or the result of suffering. There's also a great deal of stigma with mental illness, and so it may not be acknowledged. Russians are likely to greet you with a handshake, and they will make direct eye contact with you. They don't really like to be touched a lot and will save touching for close friends and family members. Russians may be loud even if they're having a pleasant conversation. They do tend to be on time or early for their appointments. Russians believe that the cause of mental illness is stress or moving into a new environment. If a person is sick, they're probably going to be put to bed, and they will try home remedies before they go in for treatment. South Asians will probably greet you orally. They may gesture like putting their hands together while they say namaste. The men may shake hands. Touching isn't really common among them. They will probably express their feelings through their eyes and their facial expressions. They will probably avoid direct eye contact with you, especially if you are older than them. They will see direct eye contact as being rude or disrespectful. Silence usually indicates acceptance or approval. They will have a soft tone of voice and see being loud as disrespectful also. South Asians believe that mental illness comes from spells that were cast by an enemy or the person was possessed by evil spirits. The Vietnamese will probably greet you with a smile and a bow. If you are greeting a female Vietnamese, don't offer to shake her hand unless she offers her hand to you first. Touch is limited more among the older traditional generation. The Vietnamese do consider the head to be sacred and the feet profane, so the order that you touch them in is important. Check with them before you're doing your physical assessment. Not making a lot of direct eye contact is a sign of respect for those in authority. They do prefer to be a little further away than what we traditionally do. They are probably going to be soft-spoken and think that raising the voice and pointing is disrespectful. They also consider that open expression of emotions or conflict is in bad taste. They are usually on time for appointments. They believe that mental illness is the result of individual disharmony or an ancestral spirit that's returning to haunt the person because of some past bad behavior that they had. When the Vietnamese are sick, they tend to take a passive role and expect to have everything done their way. The Vietnamese do believe in both Western medicine and in folk medicine. Some people still believe that traditional healers can get rid of evil spirits. They may participate in other health practices that include coin rubbing, pinching the skin, acupuncture, and herbal medicine. In order to give your patient the best care that you're able to, you need to find out about their cultural practices, their beliefs, and their health practices. Usually, asking the patient is the best way to get that information. When you're first meeting the patient, you can rely on general information about personal space, eye contact, so forth, and then watch the patient to see how they act and use them as a cue for their own behavior. So if you see the patient's not making a lot of eye contact, or if you step toward them and they step back, you probably need to take that as a cue and not try to make a lot of eye contact with them and realize that you're probably standing too close. Asking them about their health practices and religious beliefs is also important to ask to assess their needs. For example, if you ask about their dietary preferences and practices, or see if they need any kind of religious accommodation while they're in the hospital, like do they need to pray multiple times a day and be left alone during those times? Do they wear religious clothing? Do they want to refuse blood transfusions? As there are variations from person to person, even those from the same cultural background, general knowledge is a good starting place, but it is not a replacement for assessing the patient's needs. As the nurse, you need to be aware of the factors that influence a patient's response to illness, including the individual, interpersonal, and cultural factors. If you haven't had a lot of experience with those from other cultures, you might feel anxious when encountering them and worry about saying or doing the wrong thing. It's best to just ask the patient how you can help them, and then let them guide you. Recognize your own feelings and possible prejudices so that you can handle them effectively. Remember that each patient's response to illness is both complex and unique to them.